muzzle. So ideally what we want to do is have, different sizes to make sure we get the right one. I believe this one will fit the best. So how we do it, here Maverick, he's a nice little kid. So we usually like to come from behind and just put it over. And we make sure we secure it with tying it back here. And then right there. And then we're done. I use a restraint pull. We only do it on dogs, not on cats. So we can either come from the back, put it on there, pull it, and then we have the dog. So we have our nice space just in case you want to do anything, we can hold them with the distance. And that's it. So we're going to show on how to towel a cat, different style of restraining. We have our cat here, we have our towel. So we could just put it around her, grab her, and anything we need to do, we have her legs protected. And that's just a different method that we can always restrain a cat. Okay, what we're going to demonstrate is to do a urinary catheter on this dog. We do have sterile food. We have our sterile gloves, which we'll get out in a second. Here's our syringe to get our sample of urine. Here's our catheter, and then this is how we're going to actually clean the area. That's good. Okay.
This is in the courthouse. Putting it in the pre-case.
No.
Your dog gets a hamburger after this.
No.
So I'm putting on sterile gloves.
You're fine. Good boy. Good boy. Yeah. It's okay. It's okay. If he's empty, is he still gonna go see? Oh.
Did he go recently?
He went kind of recently.
I have to do this tomorrow. It's empty.
Well, he is empty.
There's no baby.
So we're gonna catch urine from Maverick. What we're gonna do is catch a voided sample. We're gonna catch it at midstream to avoid the first urine, to avoid bacteria contaminations, etc. So let's Oops, sorry. We caught our sample. We're just gonna get it with the syringe, and then we're done. Dog. So
It's very small. How do you make it bigger?
before we even brought him in, so it's nice and sterile, the location where she's focusing the probe.
Normally it does that here, you know? What's the dog's name?
Riley.
Good, Riley. Good, 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 good. Be good boy, good boy, good boy. Good boy, good boy, good boy. Oh, my good boy, Riley. Oh, my good boy. You're such a good boy. You're so brave.
And that's our sample. Okay, so we're going to demonstrate on how to express dogs' anal glands. We wear our gloves, of course. We have our lube, and then we have our paper towel to get the excess. So anal glands obviously are on the butt area. Stick our finger in, and then what we call milking them out. And we find his little butt here. And we're inside. And then we start squeezing. Whenever our fingers are back there, we can kind of assess, how full they are, the consistency. If there's anything abnormal, we like to note it to the client, and or of course the medical chart or the doctor. So we're about done. Both sides are about empty, but they still have some. Then our discharge is about normal, very liquidy. Of course we're done with that, and then now we're just going to wipe and clean. And that's it. Okay, so we're going to demonstrate on how to trim dogs' toenails. So we'll do one leg. So we're going to have my holder hold dog toenails. We can see that these obviously nails are long, but we have a quick and we have the clear part. Then of course most dogs have a dew claw, but she doesn't. So what we do is we parallel with the ground. The next one, same thing. And the next one. And the next one. Oh, baby. Good girl. Okay, so we're going to demonstrate on how to trim a cat's nails. With cats, it's kind of nice because you push their little paws, and then you can see the nails. So we get her little dew claw. Good girl. Do the same thing as a dog, just trim. Okay. I know. Good boy. And then that's it. And then if we want to check, we just obviously push the little toes. But she's done with that hand. Okay, we're going to demonstrate on how to pill a dog. We have his thyroid medication here. What we're going to do is we're going to open his mouth, and then we're just going to stick it on the back of the throat, so behind the tongue. And then we're going to close his mouth, and then we're going to either blow air in his nose or just rub his chin underneath, and then that will make him swallow. Once he does lick his nose, that means that he swallowed. So that's how we assume that he swallowed. Okay, here we go. Come here, Maverick. Good boy. There we go. That's it. We're going to demonstrate on how to pill a cat. We have our holder here, and this is Lily, and we have our medication here. We're going to tilt her head backwards, and then we're going to open her mouth wide, stick in the back of her throat, and then have her swallow it. Once she does swallow it, we can see it by the way she licks her tongue. Okay, here we go. Good girl, see? And that's all. We're gonna demonstrate on how to clean a dog's ears. We can get, you know, cotton balls. Here's our ear cleaner. I'm gonna soak our cotton balls with ear cleaner. Put it to the side. We have our dry cotton balls here. I'm gonna start with one of the ears. We're gonna pull the ear flap up. We're gonna squeeze the contents of the ear cleaner inside. And then we're gonna massage the base of the ear. And then have them shake. And then we just stick our little finger in and the cotton ball, and we get some of the excess out. Typically done. And of course, we're gonna try to get all the grooves, and then our cotton ball's clean. That's it. Okay, we're gonna demonstrate on how to medicate a dog's ears. So for him, he actually only needs a medication on his left ear. Our medication is already drawn up into our syringe. Bring in our syringe. We're gonna pull back the ear flap, and we're just gonna squirt the medication in. Once we squirt the medication in, we're just gonna massage the base of the ear, and he might do some head shaking because there's something in his ear. And that's it. Okay, we're gonna demonstrate on how to clean a cat's ears. It's basically the same thing as a dog's. We're just gonna grab the little ear, and then we're just gonna use our little cotton balls with our ear cleaner, soak the cotton balls already, and then just massage the base of the ear. We also have Q-tips just because cats have much smaller ears than most dogs, and because my finger won't fit all the way. Okay, so we have our holder, we have Lily here, and then we're just gonna get her ear and squeeze it. We're gonna massage the base. Okay, then we have our dry cotton ball. That's a good girl. And then we start getting, let's see here, good girl. Most cats are not that excited about ear cleanings, but you know, it's just one of those things you just have. And then we just start cleaning the outside parts of it. She actually has pretty clean ears. So that's how we clean a cat's ear. Okay, so we're gonna demonstrate on how to put medication in a cat's ear. So we already cleaned on Lily's both ears. She actually just needs her medication on her right side. So we're gonna come from the back so she doesn't really think that I'm attacking her. We pull the ear up, and then we stick it in as far as we can. And that's it. And then, of course, we're gonna massage the base so we can spread that medication out. And we're done. Okay, so we're gonna apply his ointment on his suture line. Because it's slightly irritated, he actually has to have this medication put on him. So we have him laying down. We're ready to clean the site like the doctor wanted it. So we're not gonna touch the actual site. We're just gonna put it on our finger and just rub it all in here. So the biggest focus was this little red lump all the way to here. Everything else, the doctor actually said it was okay, so that's all we're gonna do with them. Okay, so what we're gonna do is we're gonna place a self-adjust stethoscope. So we have this here. How we measured it is just like if it was the endotracheal tube. We have our laryngoscope ready, and then we actually already lubed it, so it's ready to be put in the PEP. We're just gonna make sure that, you know, we're not gonna put in the trachea or, you know, anywhere else, of course. We do have our endotracheal tube, so it's kind of simple. We'll just, you know, put it where the esophagus is. So. And what we're going to be listening to is to the lungs. And we're gonna also be listening to the heart. Pretty good. That's it. Okay, so what we're gonna do now is we're gonna do a shimmer tear test. We have our little tear test things. It's still in its little packet, so what we're gonna do is we're gonna eventually fold it while it's still in at the little crease, because we don't wanna fold it when they're out of the packet because that makes it greasy with our fingers. We're gonna put it in the corner of the dog's eyes on the lower eyelid, and we're gonna wait for a whole minute, and then we're gonna see what we get for our numbers. A normal dog is between 15 to 25, the tear production. So that's what we're gonna do. So we have our right and the left, so we're gonna put the left in the left eye and then the right in the right eye. Okay, good boy. You can do it. And then we just keep praising the dog for a whole minute. Hold on, love. That's a good boy. That's a good boy. Stay. Good boy. He's a good boy. We can usually do both eyes at the same time, but sometimes they're a little finicky, so that's why we just do one eye at a time. So we have about 40 seconds left. We are done. So we take this out, we read it immediately, and it is about 13. So that means that he doesn't produce that many tears, slightly lower than normal, but we're gonna do his right eye. But that's basically how the test works. Okay, so what we're gonna demonstrate now is the tonometry. We're gonna do 6 readings. He is of course a dog, so we already have the setting on there. We already loaded our probe. So what we're gonna do is just get one of his eyes and then just go straight in. Then of course when we hear the number, so I'm gonna try not to put too much pressure on him so we don't get false readings. So that one read 18, and then we can do it again to confirm it. So that one said 15, and then we can do one more to confirm what we actually got. Let's do it one more time. And that one said 15. So we got our number and it's 15, and of course that means that he is within normal, the average. So that's how we do that part. Then of course we would do it on the other side just to confirm that everything is okay and normal on both eyes. Okay, so now what we're going to do is a fluorescent stain. What we're going to check for if he has any laceration, abrasions, or any, what we would call any cuts or anything on his cornea. We do have our materials. We have our eye wash here. We have our fluorescent stain here. And then we have our black light here. And we have when we do our washings. So we're going to get a little strip out. Boy. Okay. Then of course we're going to start doing our little washes. How we're going to do the washes is we're just going to get the eye wash and kind of go swish, 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 swish. And we have our napkin here to take any of the excess out. the other eye. There you go. Then, this is when the black light comes in, we're going to turn off the lights and we're just going to check if he has any. And of course you can see his little green eyes. And if there's any of the stain that holds, that means he does have a cut in his cornea. And that eye looks good. And the other eye also looks very, very well. And he is scratch free. Just turn this off. What we're gonna do now is I'm gonna show you how to perform a water and makeup water enema. We have warm water here, and then we have our little bowl. We have our soap here. We also have our lube and also a syringe. We're just gonna fill it up with the warm water. So this is nice and warm. And we're just gonna put a little bit of soap. Have that water mix a little bit. Okay, we have our syringe. You're gonna fill it up. We're gonna have our lube ready. And then we just put a little bit at the tip of the syringe. We squeeze them out. And then the soap does do some lubrication as well as irritating, so it will actually poop. And that is exactly what we need to do for an enema. Okay, so we're going to demonstrate on how to do sub-Q fluids. We have a fluid bag here. We can mark where, or just make a note how much we're going to give. So, you know, we have the little tick lines or whatever. So if our doctor wants to do 50, then we just go to 8. And if she wants to do 100, then we can do it to the 8.5. But basically, that's how you do it. We have our new needle already attached. And then we have our open it, and that's how we let the fluids start going. So with the dog, when we're going to do sub-Q fluids, we can always, you know, get a little alcohol, clean the site. We're going to tent the skin, and then we're going to poke parallel to the body. So this is how it's going to look. You can have either a holder hold or not. We'll let this up. How we know that the fluids are going, we have our little dripper going. Of course it goes with gravity. That's basically it. Okay, so what we're going to demonstrate is how to bandage with the modified Robert Jones method. We have our tongue depressor, we're going to have our stirrup layer. We have our cast padding, we have our elastic gauze, and we have our vet wrap. We're going to actually use his left. So, how this is going to go, I'm going to put this on here. I'm going to put it on his front arm. I'm going to put it right here. And then I'm going to put the other one on the other side. Here we go. Our first, okay, so after this guy, distal to proximal. So we're going to start at the bottom. We like to leave about the 2 toes on the outside, that way we can verify if there's any swelling, any odor, anything like that coming out. So we're just going to put the cast padding around. We're going to do 50% overlap. So that's what we're doing here. And then we're going to go just below the elbow. And we'll use our unit scissors, put that off. Then we're going to do the same thing with our elastic gauze. Go distal to proximal, same thing, we're going to overlap it. On this guy, we can actually make it a little tighter. So we're going to do a little bit more of a tighter method, but at the same time not too tight. And then we just leave a little bit of the cast padding just because this stuff is not as smooth on the skin and we don't want to cause any abrasions. And then with that, and then, excuse me, before we actually do this, we're doing our stirrups. So we're actually going to, we're going to turn this around and we're going to put it right here. Turn this one around. And then we're going to actually do our last final step, which is that rope. And then, of course, we can leave a little bit at the bottom, just with the little cast padding. And then, same thing, overlap, same way, overlap at a 50%. And that's how we wrap it. Okay, so we're going to demonstrate on how to remove our bandage. What we're going to do is use bandage scissors. Of course, this part is towards the skin. And then we're just going to go basically layer per layer. Just make sure everything will be okay. So we just go in and cut. Go in and cut. We want to prevent from cutting the actual skin of the pet. So that's why we're going to go with the blunt end first. Okay, so this guy is off. And then we can do our next round. And that one we can actually do the cast padding and the elastic gauze. We'll do it the same way. We're going to make sure we do not cut our patient. I'm going to have my holder hold his back of his arm. It's okay. It's okay. You're okay. There we go. Oh, 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 oh. It's okay. And then these stirrups you can actually remove off. You want to do the other side? And then that's how you remove it. Okay, so we're going to demonstrate on how to do a splint, apply a splint the Robert Jones method way. We have our stirrup, we have our tongue depressor, we have our splint here, we have our elastic gauze and the cast padding, as well as our pet wrap. So we're just going to say that she has a break right here. Here. And we want to do, whenever we're done, just kind of leave it 2 toes out just to make sure that everything's okay. Nothing, no foul smells or anything like that. Okay. And then we're going to do our gauze. We're going to start distal to proximal. Same thing as applying a bandage. We're actually going to do overlap at 50%. until we reach the elbow part. Scissors here. Our next layer, secondary layer, is actually going to be our gauze. Start the same way, distal to proximal. Same thing, 50% of an overlap. Now we're going to just leave it a little bit before the end of our cast padding. That way there's not going to be any abrasions. And then this time we're going to turn our stirrups up. And this is, at this point, we're actually going to put our splint on. Hold it. And I'm actually going to put our little bit wrap. Same way, proximal to distal. Same amount of overlap. I'm going to be very gentle. So we're going to say our pet is hurt. Now we're going to stop just about the same spot that we stopped with the elastic gauze. What we can do is also add some elasticon tape to hold the ends so that way it doesn't go anywhere, but that's pretty much it. We're going to demonstrate how to remove the splint. We're going to use our bandage scissors. We're going to use the blunt end towards the skin of the dog, and then we're going to do basically layer per layer. We're going to do the vet wrap first. We're going to remove our splint, remove our next layer. We're going to cut our next layer off. Same thing as what we did with the bandage. We're going to make sure we don't cut the skin of the animal while we're removing. This part is basically done. We're just going to remove our two little band tapes. To go, girl. On this other side. And she is free. Okay, so I'm going to demonstrate on how to do an emergency abdominal pressure bandage. We got our primary layer, which is our telfa. We got our secondary, which provides padding. And then we got our vet wrap, which is our to protect and hold our layers, or both layers in place. Okay. So you're gonna say that her spot's right here. I'm gonna start down here. I'm just gonna go all the way around. Okay. Look at this. And do our last layer, and that's going to be with our vet wrap. Okay.
Oh, yes.
So that's basically it. And that's how our abdomen looks like. So I can kind of show a little bit of how this guy looks. There we go. And then how we're going to remove this is about the same way.
Been able to do that.
Just Hold
We
her.
tried twice, apparently it was empty.
And then we're just gonna
So
go with our
you
blunt
might be
end.
able to try to get a
first.
couple on it real quick. If not, I can try to run back after I do this discharge. Because I think the charge was.
We removed it, and she is free again. And that's it. Okay, so what we're gonna do is we're gonna triage for an emergency. This is our emergency pet. We're gonna first check her airway, make sure that it's open. So it's open. Make sure she's actually breathing okay. We're gonna check her CRT, make sure her mucous membranes are nice and nice and pink. Check the capillary refill time. So what we're going to do is just going to touch her top gum, make sure it's less than 2, and it is. We're going to actually get a heart rate on her. So we have our clock here. And we're going to get a quick heart rate on this girl. It is actually within normal limits. We're going to check for any external injuries or anything like that. We can feel, because she's kind of hairy, we can actually try to see if there's anything that we need to quickly assess. So we don't find anything obvious. And then lastly, we're going to make sure that mentally she is stable, she's, alert. She does look pretty alert, she looks very excited. So she passes her test, and she's not a true emergency at the moment. Okay, so we're going to perform a first aid laceration cleanup. We got our everything that we need, materials. We have our lube, we have our clippers, we have our saline here, the lidocaine that our doctor's going to use, and then he has his stuff, and then we have our cold pack. This is actually not going to be bandaged, so we don't, because we're going to suture it up, so we don't need to do that. So what we're going to do first is we're going to fill up our area with lube, and this is of course sterile lube. Once we have enough lube, we can actually start clipping, and that's just so we can protect the inside of the laceration. Okay, now we're just done shaving, clipping. Now we're actually going to open it, and we're just going to rinse it. Okay. So what I basically did was rinse the site with saline a few times, and then I asked our doctor what he thought, and then if he felt like it was ready and it was his turn to come in and the procedure, that's when he would take over. So I'm just going to show the update on how that's going. Okay, so this is our PPE. We have our cap, we have our face shield, and we have our gloves. Of course, what we're doing is just to prevent any type of bacteria going into our system. So everything is already done. What I'm going to actually go over now is we're going to do the pre-assessment of our teeth. We're going to look at every tooth. We're going to, going to tell my assistant here to chart down on our dental chart that she has in her hand. we're going to find any abnormalities, any lesions or anything like that, that of course that will let our doctor know. So that's what we're going to actually do right now. We're going to just map out our teeth. 201. So we have 201. Looks nice. 202 looks fine. 203 has some tartar. Okay. 204 has some recession in tartar and some gingiva. Okay, so now we're done looking at all the teeth. What we're going to do now is do the ultrasonic scaler. With this guy, what we're actually going to do is remove the tartar off the teeth. We're going to go at an angle not directly on the tooth. We're going to just make sure that we're under the gum line and go from there. We're only going to be on each tooth for a couple seconds, not too long. That way we don't prevent any nerve damage. Okay, so we're actually done with the whole scaling of the teeth. Now we're actually going to polish. The whole purpose of the polishing is to smooth out any of the surfaces, uneven surfaces, so that's what we're actually going to do. So we have our paste here, and then we're going to I'm going to go to each individual tooth. So I'm going to start up here.
Yeah, I'm just going to get some more. Okay, can you grab a time mark for black cream?
Okay, so now we're done with our polishing. We're actually going to rinse our teeth off. So we're just going to push our both buttons and just rinse. For different animals, so different species. So for dog, you know, we do have our products, and then for cats we do have our other products. Of course, what we always say is the gold standard is brushing. So what we have here is we can offer a sample trial of the brushing. So we do have a different type of toothbrush, and this is, you know, per dogs ideally, the bigger one. You have the two-headed one. So we are several different types of toothpaste. If some owners do not feel comfortable brushing their dog's teeth because the dog is a biter and they will bite the owner if they touch them out, so we don't, there's other methods we can do. They can do what we call peer support, which supports, of course, the dental health and the hygiene, and it is for cats and dogs, so that's another option. On this guy, you just pour a little bit on the food. Another, which is basically the same thing, except a bigger bottle. If the owner are feline bites, it's the same idea. It's more like a treat. You can use it as a treat. And then, of course, it helps with controlled plaque, freshen breath, for our cat owners. And then, of course, for our dogs and cats, we do have the TD, which is a dental diet, general diet. And then, of course, we have our rawhides. And then the cool thing is that these are actually treated with chlorhexidine, which helps the bacteria that form the plaque to be removed and to prevent tartar, calculus, and they do want to do brushing. We do suggest to do a multimodal. That way, just in case one day they don't have time to brush your dog's teeth or something like that, they're actually helping the pet by doing another method.